Hi there, this is Dr. Paul, and thank you so much for watching this video from Waterfront Dentistry by Paul's. Today, I'd like to talk to you about sedation and the different sedative options we offer in the office. Now, before talking about sedation, let's zoom out and look at dentistry as a whole. This is one of the only professions where a stranger has his instruments, a sharp drill, fingers, and multiple tools in your mouth, and he or she is expected to carry on work on a tooth, which is basically a calcified entity which has a live nerve, by fixing disease with either constructive fillings or something more invasive like an extraction or an implant placement. In fact, root canal treatments are considered to be one of the most painful dental procedures performed on a patient, and all this is basically needed while the patient is still coherent and he or she is expected to contain his or her emotions. It doesn't really sound pleasant, does it? It's not. It actually is not. In fact, there are days where I say, why didn't I go into med school or look into law school? But that's basically where we have pharmaceuticals helping us with sedation. So the way you look at sedation is it's an altered sensation by any kind of medicament or medication that causes a calmness or gives you a feeling of not being in danger. The most important thing to realize with sedation is there are different kinds or different spectrums of sedation. So you have something called minimal sedation, moderate sedation, deep sedation, and finally you have something called general anesthesia. So minimal sedation and moderate sedation are basically sedation techniques or sedation spectrums that involve a patient knowing where he or she is, being able to follow instructions and having a sense of calm, but being able to have all their reflexes intact and most importantly keep their breathing healthy and be able to keep a patent airway. So one of the most important reasons why minimal and moderate sedation is safely used in dentistry is because we don't expect the person to go into a state where they can have an adverse response like stopping to breathe. Deep sedation is another sedation spectrum where the patient can follow instructions but with more guidance or more repetitions will feel pain and more importantly may or may not be able to breathe, but that's why deep sedation needs more monitoring. Minimal, moderate, or deep sedation need expertise to administer, but these spectrums are considered somewhat safe to be administered in a dental office, provided the dental office and the dentist administering these techniques are licensed to do such. General anesthesia is basically a completely different spectrum where the patient is completely put to sleep in that they have no pain stimuli, they cannot follow instructions, but more importantly, they cannot breathe, and that is why a lot of monitoring and a lot of apparatuses are needed with specialized expertise to make sure the patient, after the procedure, is brought back to consciousness. So now that we know what the different spectrums of sedations are, the most important thing to realize is whether it be 1, 2, 3 or the fourth form of sedation, all of them need the following to be followed down to a T. The first is NPO, which means nothing to eat or drink at least 4 hours prior to the procedure. When you have something like a slice of toast or a glass of black coffee, that can be easily digested, but if you have something that's a little bit more fatty, then it needs at least 8 hours to be completely digested from your stomach. This is also the reason why we tell patients that we will see them first thing in the morning, especially after the dental office opens, but they need to make sure they don't have anything to eat or drink from the previous night. And some people say, well, I'm a diabetic or I am older and I need certain things to be consumed, especially medications, or I need to have certain amount of sugars in my body so that I can start administering my drugs. And to them we tell them, look, if we can at least postpone the procedure, or you taking your medications or your food by an hour or two, that would help us immensely, because once we know that the NPO status is compromised, we cannot technically proceed with the sedation technique by any means. The second, I guess, factor in sedation is, apart from nitrous oxide, which we'll go more in detail, you need to bring someone along who can accompany you back home. And this is because you will not be in any sensation to be coherent completely. This is also the reason why we tell you shouldn't be driving a car or operating any heavy machinery, signing any legal documentation, or even making any big decisions within 18 to 20 hours after these modalities of sedation. And like I said, this is not for nitrous oxide, but anything but. The third thing with any of these sedation administration is you need to make sure that you realize you should not have any kind of causation to be excited during the time of the administration of the procedure. This is also why when we do our anesthesia consult, we start off by doing a thorough medical review on you. We go over what medications you're taking, what conditions you have, because you might not realize that a compromised liver or a kidney can alter the way your drugs are being metabolized in your system. And more importantly, if you are someone who has blood thinners, or if you are someone who has a compromised respiratory system, it can drastically change the reality of how the sedation goes, not only when it is being administered, but also how the procedure goes and how you react. We also need to make sure that the form of sedation you're picking is right for you. So if you are someone who is extremely anxious, minimal, moderate, or even sometimes deep sedation might not cut it, and we might need to say you need to go see someone who can put you under general anesthesia. The other thing also we do during a consult, apart from a medical history review, is we make sure we give you all the instructions you need, like bringing home or bringing someone to take you home after. We also go over certain things like diet and certain things that you need to understand for a certain number of hours after the sedation is being administered. Very important stuff, and that's why we need to make sure we know that you need sedation, and then we have a sedation consult, and then we actually bring you in for the procedure. One of the most overlooked things are to go over finances and go over informed consent. So if you need sedation, we need to go over how much this would cost you, and the procedure of what you need might go from, hey, it was a routine filling, or hey, the routine filling went and became a need to have a root canal done, or sometimes an extraction. This is why when we do our sedation consults, we give you all this information, and that way we get you to sign some forms. So on the day of the procedure, you're not stressed out about, I wonder how much this will cost. I wonder what the consequences of the treatment could be, or if anything adverse can happen. So this is why we dot our I's and cross our T's before we bring you in for the actual sedation and the treatment. Now that you know, I guess, the ballpark of what sedation is and what it entails, let's talk about the subtleties and drop down to what is actually administered. Let's talk about nitrous oxide. So nitrous oxide is called laughing gas, invented back in 1844 by a dentist named Horace Wells. Is a really interesting gas because it's one of the only forms of giving you sedation that A, can be easily administered, B, is titratable, which means we can give you the gas and exchange it with oxygen because we have a certain apparatus that does that. So we can get you to your levels, and it is very fast in its onset, which means within 15 to 20 minutes, we know what your levels are, and we can keep you, even for a period of 2 hours, at that constant limit. This is fabulous for people who need longer procedures, and the other modes of sedation might have tapering dips. So it's very important to realize nitrous oxide is probably one of the best sources of giving you sedation, where it is instantly available. As long as the NPO status is confirmed, we can make sure you're titrated, and we can hold that level of sedation for up to 2 hours unhindered. One of the most, again, important reasons to use nitrous oxide is you don't need to be accompanied by someone to take you home. And this is because the laughing gas doesn't really like to stick around in your body and it wants to leave within a couple of minutes. And that's why once we flush you with 100% oxygen, you're actually good to go. It works on that part of your brain called the limbic system, which has the flight or fight response, and also works on receptors that most opioids or benzodiazepines, so think of Ativan and Valium, work on. So it's a very potent form of a sedation in that it won't get you extremely sedated if you are someone who needs moderate or deep sedation. But for people who have routine, concerns with dentistry, or people who are a little apprehensive, it works quite well. During pregnancy, we usually say during the second or third trimester, it's okay to use nitrous oxide, and also we say less than 30 minutes with at least 80% of oxygen. So, if someone comes in who is extremely fearful, we at least tell them, look, we can give you some laughing gas and make you feel sedated enough to give you the local anesthetic or the injection. And once that's done, we can stop the laughing gas while we do the procedures. Now let's talk about oral drugs or oral sedatives. So with oral drugs, you can go from minimal to moderate sedation, and sometimes even to the onset of deep sedation. That's why it's very important to realize that dosage is key. With oral sedation, we usually go with benzodiazepines, which are these pharmaceuticals that are extremely potent in what they do and have a very good therapeutic index. What that basically means is, no matter how many times you take a certain drug or benzodiazepine, it might not kill you, but it will alter your consciousness. So it's a very safe form of sedation. Think of Valium and Ativan. These are mostly prescribed by MDs, but they have an 18-hour window through which it operates. That's way too much for dentistry. So what we use is something called triazolam or halcyon, and it comes in 0.25 milligrams. It usually works for 45 minutes to 1.5 hours, but the only caveat is we need to give it to you 1 hour prior to the procedure, so the therapeutic effect of the drug is actually felt for the procedure. So basically your chair time increases by 1 hour, and we need to make sure we know that you need the drug and call this into your pharmacy before, so you can bring it along. We also keep some at the office, but we need to keep a strict measurement or monitor the numbers that we are dispensing them out. The other thing with this form of sedation is we tell the patient, again, you need to bring someone to escort you home, unlike nitrous oxide. And most oral drugs need a healthy liver and a kidney. So unlike nitrous oxide, which directly enters into your bloodstream, goes into your limbic system, works, and then is flushed out, which basically means it doesn't really need you to have an extremely healthy liver and kidney. Oral drugs and even IV drugs need you to have extremely healthy livers and kidneys to make sure that they work really, really well. The other thing again with oral drugs is if you are taking certain medications, especially the versions of antidepressants, it can compromise how the oral the sedation or the oral sedatives actually work in your brains. So again, the chemistry gets altered. Now let's talk about deep sedation. So any oral drug, if you take them, more of them, it can enter into deep sedation. But most of the time, people or dentists use something called IV or intravenous administration of certain drugs to get you deep sedation. Now, this involves a much more robust means of monitoring your system, because the likelihood of you having an adverse effect or adverse incidents like a breathing or a respiratory problem is higher. That's why we are very cautious about moderate sedation and deep sedation in most practices. General anesthesia is something we rarely do unless we have a hospital-based setting, or we have a number of professionals who can help us make sure the patient is not only put to sleep but is also brought back after the procedure is done. If you have any questions about what I just mentioned, and if you have any comments, you can reach out to the office at 613-966-1225. Again, thank you so much for watching.